Hello, my name is Mars Lopez, and for my surgical rehabilitation project, I'm doing it on a orbital enucleation and a laryngectomy. What is an orbital enucleation? An orbital enucleation is where they remove the entirety of the eyeball itself, but keep all of the orbital content still inside it and located in its capsule. It is most often caused by tumors, severe infections, pain, trauma, sympathetic ophthalmia, and for cosmetic improvement. Like I said earlier, it can be caused by trauma, and that trauma is often deemed when there is no visual potential left in that eyeball, such as in this image of a screw being left in somebody's eyeball, or in cases where a metal straw would be stuck into somebody's eye. Okay, post surgery, once you get out of surgery, you'll have a cloth over your eye to help keep it clean. Then at home, you'll change the eye cover every 1 to 2 days to ensure it's clean for 4 weeks. You'll also be getting adjusted to having only one eye and will be put into visual rehabilitation services where they'll help you get used to that change. And after 4 to 6 weeks, you'll meet with a professional to get a prosthetic eye. Okay, for when living with one eye, you lose a ton of things. You lose your visual awareness. You lose your speed and grasp. You have a loss of binocular vision because you only have that one eyeball, which also affects your depth perception because having your two eyes is what allows us to visualize depth. And you also have a loss of peripheral vision because whatever side you lose your eyeball on, you lose that whole side of vision. So one way to combat this is with visual scanning training, and it is aimed to help patients pay attention to multiple stimuli that lie outside of the focal midpoint of their vision. Patients might only start out by looking a few degrees past their midline, but eventually it'll gradually expand outward more and more. And they do this by doing games such as Visual Switch, which can be seen over in this corner where they'll light up a light and the person will have to look up and say it out loud which one it is. By alphabet scanning, where they'll have the alphabet and have to find the letter. By playing games as like I Spy, Keep It Up, or Cup Shuffle, where with games like Keep It Up, because they have the lack of depth perception, it'll be significantly more difficult to keep two balloons up at once, as you won't be able to tell how far out it is, and if you hit one balloon to the injured side where you don't have an eyeball, you'll effectively have it out of your range of vision and will lose track of the balloon. Another form of visual rehabilitation is with audio-visual scanning training, and that is done by having sounds indicate which side the patient should look to, having to learn to fully rotate their head to look over, and encouraging the patient to look upon their injured side. They will do find the target, which will have a screen displaying the target, and they'll have to track it with it playing audio cues of where it is on the screen, as well as playing games such as object search, where they'll place various objects around your room and ask the individual to find a specific object, providing verbal cues to guide them on their search. Here's an example of Find the Target, where they'll be playing the game and having to listen to where it is on the screen. And this is all in hopes of having them be able to regain their vision. Well, not their vision, but like their depth perception and adjusting to having only one eye. Okay, a laryngectomy is a surgical procedure that removes the larynx. The larynx is also known as the voice box, and this surgery alters the ability to breathe, speak, and swallow. It can be caused by trauma, cancer, and radiation, and in this video below, you'll be able to see the before and after of the surgery, where they'll have a stroma introduced into their throat, and that's how they'll breathe, disconnecting their mouth and nose from their lungs, having them breathe just from the stroma. With it removing the voice box, you'll also need to relearn how to speak. And restoring speech after surgery can be done through 3 separate methods. There is esophageal voice, which esophageal voice involves inhaling or swallowing air into your esophagus, and then using that swallowed air to vibrate the muscles and create sound in your voice, sound with your muscles. There's also electrolaryngeal voice. There's also electrolaryngeal voice device, and this will create artificial vibrations that will mimic the vibrations of vocal cords, allowing you to speak. And there is a tracheoesophageal voice prosthesis, and this will be added in between the stroma and the esophagus, and it will, if you close the stroma opening, allow you to create vibrations. And then here is a video of each one.
Hello, my name is Tora, and I have a voice. Hello, my name is Tora, and I have a voice. Hello, my name is Tora, and I have a voice.
So that is all 3 of the different methods. And with esophageal voice, it is caused by trapping air in the mouth and swallowing it using your tongue, making sure the swallowed air is pushing enough pressure into the esophagus to cause the airway to vibrate, generating the sound. It is a hard skill to learn and requires a good amount of tongue mobility, and typically only about 1/4 of patients are able to fully learn and confidently use this form of language. With the other 2, the electronical device can be used by anyone, but some people don't prefer to like it because of how robotic it sounds. And the tracheoesophageal device prosthesis can be put into anybody. Other therapies that will be needed after this surgery will be learning how to swallow again, learning to breathe through the stroma, therapy of the neck, and getting your smelling and taste. Because this surgery involves the neck, after the surgery, your patient might feel sore, so some stretches that they could do after the surgery is the side neck stretch, which will help loosen the neck and shoulder muscles, the backward shoulder roll to help stretch and release the shoulders, and the pectoral stretch using and stretching the pecs and shoulders. Relearning how to swallow, this will be also difficult because this surgery removes the epiglottis, which is the thing that differs which side that food goes onto. But because the food only has one pathway to go down now, learning how to swallow can feel different or weird. But those people will visit a speech therapist who will allow them and help them to communicate and swallow, and help them teach strategies and build confidence in swallowing with the stroma. Thank you for listening to my project.